For those who are about to watch this DVD, I'm very excited to bring the information that is contained about a number of the experts who have helped us help veterans who have suffered blast injury. And because of the exposure to blast, they have developed post-traumatic stress disorder. They have also suffered comorbidities, which means other injuries that have been associated from their combat. Also in this DVD, there will be beautiful people who have helped us on a pro bono basis work with so far 3 vets, and we're about to get a 4th veteran who all of these gentlemen have been either are currently in the service or have been discharged with major problems with cognitive functioning. There have been other problems, sometimes with balance, which oftentimes is involved with suffering exposure to blast. The approach that we have taken has been based on our work with civilian population, and these include people with stroke, other types of brain injury, and also including near drowns and even infections of the brain that I have pulled together from other medical centers. Dr. Richard Neubauer, some of his excellent work in the beginning of utilizing hyperbaric oxygen along with other kinds of treatment to help bring people back suffering different kinds of brain insult. The veterans that we are so pleased to have helped have been filmed already. We have a neuroradiologist talking about the effects of the brain scans that were done before and after. There will be a film by a forensic psychologist, Dr. Gran, who so graciously also stepped up pro bono to help us identify the actual psychological problems that these people were facing. Dr. Gran performed a 5-hour forensic exam before and after the 40 hyperbaric treatments that were rendered to these people. And we're going to be hearing from Dr. Gran his own impression of the 3 to 4 vets that we have had the opportunity to help. Also worth mentioning are the American Red Cross in Florida has a division that is specific for veterans of Iraq and Iran who have they are helping these young men reintegrate into society. So they were very significant in helping our veterans, get lodging, food, things like this, to allow them to be here so that we could do the brain imaging, that we could do the psychological testing, and the results have been spectacular. These gentlemen were suffering severe brain injury according to the SPECT scan interpretation by Dr. William Maxfield. They were suffering severe depression. They were suffering other cognitive problems, memory problems. Each of these vets, with the exception of one, have attempted sometimes more than one occasion to end their lives. These are young men who have been brave, who've put themselves in harm's way, and were discharged with a lot of medication, which only made them more fuzzy. They knew that they weren't right, and they didn't know what to do about it. The unfortunate thing is that I believe that there's they are an example of many, many, many of our soldiers coming back from being exposed to blast injury and are left similar to them with little direction on where to go or where to turn. The actual effect of our treatment, and one of the things that we still are waiting to get information about, is the blood studies that have been done. So we have some pathologists who are yet to determine what biomarkers we may have found in blood samples. These biomarkers require laboratory equipment beyond most laboratories. However, we're still waiting to hear from them. Some of the blood has been frozen. Some blood has been tested, and so we're still waiting to hear from the laboratory on that part. However, the results have been rather spectacular in a 30-day period. There were 40 hyperbaric dives. These dives were anywhere from 1.75 to 2 atmospheres of pressure. The difference in pressure simply means how much oxygen has been pushed into not only their brain but the entire body. We've been thrilled to be able to participate and to see the changes that have been filmed for this audience, to realize that an awful lot can be done. In terms of finances, I can't speak to the laboratory cost, but so far these results in a 30-day period would have cost less than $20,000 per person. When we look at the ongoing psychological VA costs, the medication that the government is supplying these young men, rumor has it there's also a young woman who's been horribly injured also in combat and is trying to find her way here. The cost is really minimal when we take a look at what the long-term costs are that have been associated with treating PTSD over a number of years. So with that introduction, we now are going to be taking a look at the following messages and experts that so graciously have helped us help these people. And hopefully, because of this pioneering work, the results that we have compiled have never been done before. It's hoped that we will be able to help an awful lot of our own fighting forces reintegrate back into their lives and go forward. All of the young men that we have worked with, one now wants to run for Congress in Indiana. Another gentleman that was a 3.9 GPA student in marketing is trying to find a way that he can get this message out to other veterans. And the third young man is very interested, from Houston, is interested in going into the marine sciences and feels that he can now. So with that introduction, we'll go forward with the rest of this DVD and hope that you enjoy the excitement and the hope that has been developed here in this center.